Hi, everyone. This is Tori Siloway, and I just wanted to welcome you to the webinar. We're going to just take about 30 seconds here to wait for more people to get on, then we'll get started. Okay, well, it looks like we've got a good number of folks already on, so I'm going to go ahead and get started. So welcome, everyone, to today's webinar. I'm Tori Siloway. I'm the Director of Policy and Financing here at Safe Babies, a program from 0 to 3. And we're happy to have you all on here. I'll be moderating the webinar today, the critical role of parent-partner programs in helping parents navigate the child welfare system. Next slide, please, Kylene. Great. Today I'm going to, just a quick overview of the webinar today. I'm going to share some high-level findings from our report. Our new report, The Critical Role of Parent-Partner Programs, Policy and Practice Considerations. And we're going to drop the report link in the chat in just a minute. But we also have a great panel of speakers who I'll introduce shortly. And we'll spend most of our time together hearing from the speakers today who work at different parent-partner programs across the country. Next slide, please. And also just feel free, there is a Q&A function here at the bottom of your screen. So feel free to place any questions that come up there. We're going to try and reserve time towards the end of the webinar for Q&A. It's possible if there's a direct question to one of the panelists, they may answer it directly. But we are hoping to set some time, about 10 minutes at the end for Q&A. Next slide. Or you can stay here. Thanks, Colleen. Just wanted to acknowledge our funders for this work, the HRSA, the Health Resources and Services Administration, and also the Ballmer Group for their support for this work. So thank you. Next slide, please. So the best part of putting this report together that I mentioned is being able to hear really from all the parent partner programs working in the field, and just to hear about their work and how excited they are about their work. So I'm happy that we can bring at least a few of those programs on this webinar today so you can hear from them. Just really great, some of the great work that's happening. And I'm happy to introduce them to you. And we are having a little bit of a challenge just with a little bit of the technology for one of our speakers, but I'll introduce everyone here, and we're hopeful that Lee can join us here shortly. But I'll start with Kim Navarro. Kim is a birth parent with lived experience navigating the child welfare system. Kim is a parent partner and Makua ally with the Family Wrap Department, which is an agency in Hawaii called Epic Ohana. Kim also works as a Makua ally. She partners with pregnant women with perinatal substance use to connect them to health services, prenatal supports, and resources to increase healthy outcomes for the mother and child, including prevention of entrance into the child welfare system. And in addition to her direct service work, Kim is very actively engaged in advocacy efforts at the local, state, and national level, including working with us as a parent leader at 0 to 3. So we're really lucky to have Kim work with us as well as the great work she does in Hawaii. Oh, it looks like Lee is joining us. I see her name here. So I'll go ahead and introduce Lee. Hopefully she'll come on camera in a minute. We have Lee Jackson, who's the parent-to-parent coordinator for the Circle of Care, an organization in Oklahoma. Prior to working for Circle of Care, Kim worked as a youth mental health specialist for the Mental Health Association of Oklahoma. I'm sorry, Lee, excuse me, Lee. And Lee also worked for the Oklahoma Human Services Department as a permanency planning caseworker. So welcome, Lee. And our next speaker, we have David Schuster. David worked for 6 years as a mentor parent and has since become the mentor parent program manager. So he manages the other mentor parents. And he works for the Dependency Advocacy Center, an organization based in Santa Clara County, California. And as the mentor parent program manager, David manages 7 mentor parents who focus on serving child welfare involved parents with substance use disorder, mental health concerns, criminal involvement, or IPV. Sorry, or IPV. Next slide, please. So welcome to our speakers. So I'm going to spend just a few minutes going through some of the highlights of our new report. And here it is. This is just a snapshot. And we have a QR code here, and we'll also drop the link if we haven't. We'll drop it again now to our new report in the chat. There, I see Colleen just put it in there. Next slide, please. So I just wanted to share a little bit how we did our research for this report, which is a little bit different from some of our other policy briefs here at Safe Babies. So first, we looked at the research on the effectiveness of parent partner programs. I'll say the research is somewhat limited, particularly in child welfare, but there are studies that have demonstrated impact on some of the key outcomes, like higher rates of reunification for parents who participated in the program, lower rates of reentry for children whose parents are involved in the program with working with the parent mentor, as well as increased participation in services and court hearings. So increased engagement, basically, of the parents as well. Currently, the Iowa Parent Partners model is the only program model currently included in the Family First Prevention Services Clearinghouse. And certainly we'd love to see an increase in the number of parent partner model programs that can be funded through the 4E there as well. There's also some federal guidance that we looked at, including from other fields that use parent partners like mental health and substance use. So notably, the Children's Bureau identified parent mentors as a key strategy that states should implement to help parents better understand what to expect as they interact with the child welfare system, as well as an effective strategy for increasing engagement of parents in their services and planning efforts. And also in 2023, in a sign of recognition of the important role that parent mentors play in different fields, the SAMHSA, the Substance Abuse and Mental Health Services Administration, developed national model standards for peer support certification, inclusive of substance use and mental health. But we just, in the way that this report is different, we mostly focused our work here on interviewing parent partner programs. So we talked to 10 programs across the country, and we'll feature a couple of them today, just to hear about how they operated, how they got started in this work, how it's funded, as well as just hear about the challenges and successes of this work. Next slide, please. So just some level setting for when we talk about parent partners here today, what I'm talking about. This is how we defined parent partners in this brief. There are other terms that you may be familiar with, including parent mentors, parent support partners, parent allies, parent navigators. So they can be used somewhat interchangeably, but we use the term parent partners for this brief. And we defined it as parent partners are individuals who have lived experience navigating the child welfare system as a parent, who understand how the child welfare system works and can help other parents who are currently involved. We did distinguish parent partners somewhat from parent leaders. Parent leaders are individuals whose focus is on incorporating the lived experience they have at the child welfare and court systems level. So using their experience really to focus on more systems level and policy level advocacy work, but you can be a parent partner and a parent leader as well. and we work with some who do that. Um, So just a little snapshot on, as you'll hear from our speakers, parent partners can engage, really work on a wide range of different activities, depending on their organization, depending on how their child welfare system is structured. These are some of the core activities that they're involved in, including mentoring other parents who are going through the child welfare system, helping parents navigate resources, including identifying resources and services available, understanding like eligibility criteria, helping them access those services, training, including of other professionals such as caseworkers, child welfare caseworkers, court staff, even judicial officials, and even advocacy, so particularly for those parent leaders who are involved in working to support systems change in their communities. So these are just some of the things that parent partners typically do. And we have I'll just say a great example in our report of a day in the life of a parent partner. It's from Kim Navarro here. And it's great, just shows you sort of a flavor of all the different sort of work that they do and the work they're involved in. So I recommend checking that out. Through our interviews, programs identified a couple of key challenges. Next slide, sorry, coming, that I just wanted to mention here. First, finding funding to implement or expand their program was a common challenge we heard about. Programs, from what we heard, use a mix of private funding, state funding, and federal funding. Some states do put in their own funding. I know Washington State is one that supports their program through state funding. There is currently no dedicated federal funding supporting parent partners in child welfare, and so that's something certainly, obviously, we'd love to see happen. Second, getting buy-in and support from other professionals in the field and really recognizing the importance that parent partners can play. Obviously, the programs we talked to felt that their parent partners were doing amazing work and incredibly valuable. But it's really getting the field to sort of fully embrace them as really a critical member as part of the workforce. And another was, we certainly heard about barriers to hiring and sustaining the parent partner workforce, including things like making sure that parent partners are paid a sustainable wage and a livable wage to recognize really the work that they're doing. Next slide, please. And so I'm sorry, this is, so we incorporated this into our brief. This actually comes from a convening that 0 to 3 and Safe Babies worked on with parent leaders last year, last December. And they identified things to consider before bringing parents with lived experience into a parent partner program, or really starting a parent program. These are the things that they wanted folks to know, sort of in their own words, that they needed to be thinking about, and things to have in place before you really get started on this work. So several of these overlap with things that we heard from our own interviews as part of our research, including compensation, the importance of compensating parent partners, again, with a wage that's equal to the work they're doing, valuing the experience of parent leaders as a member of the workforce, getting buy-in from judicial partners, and again, needing to identify funding to create really sustainable programs were some of the things that they mentioned. And there's others in there as well. And to my next slide, and I'm almost done here. So this is a snapshot from our brief. Our brief focuses on these 10 policies and practices needed to implement and sustain parent-partner programs. So this is what we heard through our interviews. We don't have time to go over these in detail here, because again, I want to spend most of my time with the panel, hearing from the programs. But I'll just mention a few of these here. Certainly several of the programs talked about incorporating parent partners into the process as early as possible. Ideally, the day that the child welfare case opens, or at their pre-removal conference, so they have somebody there that they can, a parent, at their sort of most vulnerable moment, has someone there they can work with who has the experience of having gone through the system, experienced it themselves, who can support them. One of the main things all the programs talked about was the role of parent mentors or parent partners, helping families navigate the child welfare system and really being knowledgeable about what's available in their community, what the eligibility criteria are for programs and services and how to access them. So that, I think that really gets it. The next one, which is being purposeful about onboarding and training, which was also emphasized to make sure the parent partners felt like they were prepared for all that was expected of them when they were brought on board, because it is a big job. I already mentioned the importance of funding. Also, and I already mentioned this as well, but I'll say it again, that parent partners should be compensated fairly for their work and the unique value and perspective they bring. And finally, that ensuring that parent partners who are hired into the program are reflective of the different communities and populations they serve as being really critical. It looks like there's a little box. I'm not sure, Kylene, on the screen again that popped up. But I think we're done with the slides, so we may be fine. So again, those are just some of the themes that we identified through our interviews with the parent partner programs. And the last thing I wanted to show you, oops, you can't see it, at least on my screen, there's a black box covering it. I'm not sure why. But this is just, it's fine. This is an appendix. We have an appendix in the report. It lists all the programs we talk to. So it just provides a brief description of them and provides some more flavors for sort of those programs that we talk to. So you could look them up, even reach out to them. I'm sure they would love to hear from other. So yeah, I see that we cannot see the slides. So kindly, maybe we'll take down the slides because we're shifting to the panel anyway, and hopefully that will not cover up the panelists. So I can see the panelists. So hopefully folks in the chat, I'm assuming y'all can see us as well. Let us know if you can't. So we're gonna I'll take a deep breath here, and now I'm gonna put on my moderator hat and welcome all the panelists again. So again, we have Dave Schuster, Kimberly Navarro, and I think Lee is here, Lee Jackson as well. And we're gonna start out the panel. Okay, so some folks are saying they only see me. So I think what's gonna happen is when the panelists start speaking, you'll see them. So that should clear up in just a second. So sorry about that. So let's just start out, and I'll start out with my first question. And that is just to tell us, each of you, a little bit about your program. Just get us a little bit of a picture of what your program looks like from the ground level, a little bit of a flavor so folks know sort of the types of programs that each of you operate because they are really different. And if Lee, if you are there, well, maybe I'll start. Dave, I'll start with you because I see you on the screen. So why don't you go ahead and give us, and then I'll go from there.
Dang, I was hoping you were going to go with somebody else. My name is Dave Schuster. I'm the Mentor Parent Program Manager for the Dependency Advocacy Center's Mentor Program. I'm just going to talk a little bit about how our program got started. DAC, the Dependency Advocacy Center, is a nonprofit 501c here in Santa Clara County. And in 2008, DAC got the contract to represent the parents and some of the children in the dependency system. Before DAC got the contract, there was a mentor program that had already been started many years back, but it was one mentor, part-time, a couple hours a week. And then when DAC started, they started really expanded the program. We had it started with just one mentor mom, and then the programs expanded to include mentor dads as well. The program in 2009 had 2 part-time moms and 1 part-time dad. As we kind of evolved and kind of learned how to run this program and how useful it was, we've expanded to we have 13 mentor parents in our program as a whole. I'm only going to talk about the program that I run, which is the Open Case Mentors. So the way my program works is every open case that comes into Santa Clara County, open dependency case that is controlled by the court, comes through my office. We're either representing the parents and or some of the children. And then I will assign a mentor parent to that case, so long as the client, I don't even call them client, as long as the parent has either IPV, substance use disorder, mental health, or criminal involvement, I'm able to provide them a mentor mom or dad. And my program really stresses that first day. Like Tori has said, for me, that first day is the absolute most important day. If you can imagine walking into the unknown, and walking into the unknown, your children are on the line, your identity has been taken, and to go in alone is incredibly scary. So it's important for me to have somebody there on that first day to sit and talk with that parent and just kind of download, what are they experiencing, hear their story from their point of view. And that mentor parent is with that parent for the life of the case. So it can be years where they're working together to try um, to help the children by helping the parents be better parents. We've immersed ourselves in every service that is ordered by the court, and we have relationships with all of the service providers. And uh, it's been pretty successful. We always have those wins and then the losses. They happen too. Um, but our theory is if it doesn't work the first time, at least they've had somebody loving them for while they couldn't love themselves, and really help them through the system and to feel the support, just in case it ever happens again. They have already experienced what it's like, and they can get recovery later on. So anyways, that's kind of in a nutshell what we do and where we came from.
Awesome. Thank you, David. David, did you say how many children y'all serve there in the county there?
Okay, so we don't work directly with the
Sorry, with the
children.
parent. Yeah, go
Yeah,
ahead.
we my the company itself represents all of the parents. The mentors themselves have uh, a caseload of about 30 parents per mentor parent. So we have about 173 roughly parents in the system that we work with.
Great. Thank you. Thanks for that overview, David. That was great. Kim, I think I'll go to you next. It'd be great just to hear about your program.
Thanks, Tori. Um, so yeah, I work at an agency called Epic Ohana, a nonprofit that houses our parent partner program within something called Family Wrap Hawaii. Um, we provide um parent partnering services that walk alongside parents who are currently navigating child welfare within a family team meeting space. And so we attend these meetings alongside our team of a facilitator, a navigator, and creating the team, bringing everyone together regarding their social worker, service providers, maybe the resource caregiver, in their case, their supports, their natural supports, and really it could range from helping them to clarify what's being asked of them, being able to help them to advocate for themselves in regards to their needs or what they may be concerned about, how to maybe write an email or talk to their social worker. We can go to court with them and be present with them. Parent partnering within that parent partner program is again supporting parents that are currently in the system. Another program that I work in that provides parent partnering is called Makua Allies, and it's more in the prevention side of things. We work with pregnant women, like you mentioned, who are using substances during their pregnancy. We're able to go out and outreach them and just meet them where they're at and connect them to prenatal care, connect them to, parenting services, um, really starting to have those conversations about how they can connect and start that nurturing or bonding and attachment to their child, being able to look at stability and what might come up if they're approached by child welfare at the delivery um, at delivery. We do support with substance use treatment, and that could look different for everyone. It's more of a harm reduction approach, considering that they don't need to be abstinent or stop using immediately just to work with us. Sometimes what that could look like is multiple different options or attempts to go to detox or to get into a treatment program. And if they're not ready for that, we continue to meet with them. This could look like if they're living at a beach or at a park or in whatever living environment their situation is at. And we found that working with these women helps to build, I mean, when we build a rapport as their peer, having lived that experience ourselves, it helps them to first believe that people care about them, right? The community cares about them, and then eventually to trust other providers to be part of that. Building connection with their baby can include maybe talking about going to a hospital tour, really normalizing pregnancy and increasing their excitement in that, attending prenatal appointments with them. I've attended ultrasounds with moms. I've even helped to support dads as well, if there's a dad involved, so that he can be part of that process as well and connect to his baby. Um, we ideally a parent partner can hold about 10 cases. And again, what their task would range from is not only attending monthly meetings alongside the parents, but they're also able to meet with them weekly to talk about things that might be coming up and things that they might want to address. We check in with them about visits. We check in with them about how how they're doing. If there's any barriers that come up. I've caught the public transportation, the rail system or the bus alongside parents so that they could really feel like, oh, I can, how this could look like, right? I've supported a parent where she wasn't able to make it to the facility where her baby was being cared for because there was it was an unknown or unfamiliar route for her. And so again, using the bus system and the rail system, public transportation to be able to show her that, oh, let's go together. Let's see how far this walk is from the bus stop or things like that. And so parent partnering in our program definitely is hands-on, that side-by-side approach. And again, to really help promote the belief in the parent to that they can do it themselves.
That's awesome. Thank you, Kim. You're getting lots of applause and love here if you can see that on the screen. Um, Leah, I'll kick it over to you. I know
Yeah,
Leah, your camera doesn't work, but that's fine. We can hear you. That's great.
you can hear me? Okay, good.
Yeah.
Awesome. Yeah, so I work in the state of Oklahoma, particularly in Tulsa, for Parent to Parent. It's a circle of care program. We are modeling the parent partner program out of Iowa as closely as we can to implement it here in the state of Oklahoma. So, what that means is we hire individuals with previous child welfare history, train them and equip them, and we partner them with someone with an open child welfare case. We currently have 24 mentors across the eastern part of the state. We are in about 34 counties, working with these families on a daily basis, helping them navigate what is the child welfare system here in the state of Oklahoma. The goal of this program is to increase the reunification rates across the state, as well as minimize the retention rate of families re-entering in the system. We want kids to come home to safe and stable families. And so we are partnering with Oklahoma Human Services to ensure that that happens, but giving people with previous child welfare history a voice and a job. A lot of the individuals that are a part of our program have troubles finding jobs outside of our program. And so we give them that opportunity to use their voice and their experience to give back. And so, very similar to both David and Kimberly's programs, we we are not speaking and advocating on behalf of the parent. We are empowering them to advocate and speak for themselves. So what we do is we will go into the courtroom with them. However, we will sit in the very, very back and take notes. But what we've done beforehand is empowering that parent to go in prepared to advocate for themselves, to say, hey, judge, I'm doing this, this, and this. And I'm really working my service plan. We help them prepare for what we call family team meetings, where DHS is there, foster parents are there, community partners that are supporting this parent, and they get to advocate for themselves in hopes to get least restrictive visitation and unsupervised and hopefully TR based on the success of what the parent is doing as they navigate that system. We also help equip them with services, whether that be food pantries, housing, classes, counseling, helping them find those things that they need to do in order to get their children back in their custody. And we help them so that when we bounce out, when time comes for case closure, I apologize, that we've equipped that family enough that they can be successful without us, that they've done the work, they've put in the work for themselves. And it's because someone who knew what it was like to be in their shoes came alongside of them and said, hey, I can do this with you. I know what it's like to be in your shoes. I've been there. I've done this. Let's do this together. And so that's a little bit about our program. It is subcontracting. So our mentors work when they want to. Essentially, there are job requirements, there are documentation requirements, but we pay them for the work that they do. They undergo several different trainings so that they're prepared for anything that they may come across in the field. So that's a little bit about our program. There are a lot of similarities. And so I could just repeat some of those, but I feel like you guys get the picture on what our program is here in Oklahoma. So.
Great, thanks, Lee. I see some folks are putting in Q&A questions in the chat. And maybe as the panelists get a chance, if they're not talking, we may be able to answer some of those directly, and I may try and weave those into the questions here, but we will try to get to those. I'm looking at some of them right now. So we'll hold on to those for just a second. We'll try to come back to them. I did want to ask, maybe David, I'll start with you. I highlighted some of the challenges that we heard about from our research and our report regarding running or expanding a parent partner program. Just from your experience, I know you've been at this for several years now, more than several years. What are the key challenges that your program has faced along the way? And how have you guys sort of overcome them?
So, some of the challenges that we've had is we have in Santa Clara County, a high, the Spanish speaking language is it's a requirement here. I have a hard time finding enough Spanish speaking or bilingual mentor parents. I have 4 Spanish speaking mentors on staff. So that is one of the challenges. Is I want to make sure that the parents that end up with the dependency system or involvement in the dependency system have somebody that speaks their language, knows their culture and everything else. Is very, very important to me. And the success for those parents is paramount. I can't even imagine how terrifying it must be to not understand what's going on, and to have that that experience. So it's very important to me. That's one of the big challenges. At first it was difficult to get buy-in from the court, from the judges, from the court staff, but being consistent and being supportive and being involved in all of the aspects of our parents' case plan has helped us become a valuable member of the court process. We do all the mentors are under the attorney-client privilege. We are we are agents of the attorney. So, and I was just getting ready to put that into the chat. So we have the attorney-client privilege. So when we go talk to our clients, that conversation is privileged. So that has been a little bit challenging because we don't communicate with our department at all. We communicate with them, but we don't communicate them on the level where we provide any information for the parents that we serve. So kind of getting everybody on board with that, it was a little bit difficult. But yeah, no, those are a couple of the highlights I think that we've had to work through. One of the big ones is, and I get this a lot, is how is that relationship between the attorney and the mentor parent? The attorneys really benefit from the mentors being on those cases. We share the same database. We share all of the sharing of the information, so we are able to really make the attorney's job a little bit easier when it comes to communicating with their client, with knowing what's happening on a day-to-day basis with the people that they serve. So getting the mentors all involved, trained up with the database that the attorneys use was a little bit difficult as well. But that's been a huge benefit, And all of the mentors the majority of our mentors they've never had an office job. They've never had this kind of thing. So just having to train them up on all of that is a challenge, and it's a continuing challenge.
Great. There was a couple questions, one in the Q&A, one in the chat, David, just about if you guys were able to serve, were you sort of parents of other cultures, and I'm guessing also other sort of someone said speak other dialects. Are there other, even beyond sort of Spanish speakers that you have? You're in a very diverse part of the country. I know there in San Jose, California. Imagine you guys have all different parents.
We have access to all of the court interpreters and the court staff, and we utilize those language resources, but Spanish and English are the predominant ones. And I would love to have people on our staff that speak every language, but it's hard enough to find English and Spanish. So yeah, we do utilize anybody that comes in, if whatever language they speak, we will work with them. It just makes it a little bit more cumbersome.
Gotcha. Great. Kim, I'll ask you the same question. What are the challenges that you've seen in running your parent partner program there in Hawaii?
I think my response is definitely something that will kind of uplift one of the questions I saw come in regarding criminal background and things like that. Also wanting to mention that the importance of building support from leadership within the organization that are housing parent partners, and also a contractor like DHS for like child welfare, for example, here in Hawaii, and building champions. And what I mean by that is because of the pilina, or the relationship that the agency I work for has with child welfare, the Department of Human Services, they were able to come to an agreement or an understanding, and really looking at, the Attorney General's position regarding their role in trying to minimize risk for the state, of course, but still being able to come to an agreement to allow us to come let us know like what the waiver process would have to include so that we could work with families. So we're kind of like a partner alongside our state's Department of Human Services, in order for us to be contracted through government contracts and things like that. It was a difficult process, is what the former ED has mentioned, and wanted to uplift. But it was a difficult process to get to that point. It took time. We like to say that we're in a marathon, not a sprint. And so really to malama or take care of those relationships to ensure that they could give us a chance, right? people with lived experience, whether with their own child welfare, because of their own child welfare case, or because a lot of us have, criminal backgrounds or come with experience and records, if you will. And we are constantly looking at how we can take care of those relationships by means of we go through a very long, extensive waiver process that really helps to kind of put the story behind what happened surrounding our case. And then also, what are we doing to address that, right? And what are the supports we have in place today to help us in wellness and things like that, especially because we are working so closely with things that are so close to our own experiences, our own past, the hardest parts of our lives and things like that. And so that was a barrier, of course, for us. It continues to be a barrier for funding, considering that certain funding sources, right? It kind of because of our criminal backgrounds or because of our histories and things like that, um, the funding can be impacted. That can be a barrier um, for that. And so, yeah.
Great. Thanks, Kim, and thanks for addressing that issue specifically that was asked in the chat. And we also brought that up because we heard about that from our interviews as well. We included some of that in the report about some of the challenges that places were facing around criminal background checks and around hiring and using federal funding in particular. Leah, I'll ask you the same question. What's sort of challenges have y'all run into there in Oklahoma, and how you address them?
Yeah. So we are fully contracted with our Oklahoma Human Services. We have a full contract with our state office, which is really great considering our program has only been around for 2 years. It has been very helpful. Now with that, there's been more challenges than we anticipated, simply changing the mindsets of those who work within the human services here. This is another person that is on the case working with their families, and it can oftentimes seem overwhelming for some of the workers here in Oklahoma. And so even though that state office fully supports our program, fully supports what we do, it has been a lot harder down on the ground with the workers and the day-to-day people that touch families and cases to get their minds to shift. We present our program as a system change. We are not just a program to be utilized by DHS to help the family, but we are changing the way that we are changing the way that the system looks and treats families here in the state of Oklahoma. And with that comes hardships, right? There are lots of opinions, lots of biases that we are working to shift and change, that these people that we hire as mentors are incredible individuals that can help serve families across the state, and not to be a hindrance on the case, but we are supporting that worker. With my history in child welfare, it's a lot of work being a permanency planning caseworker here in the state of Oklahoma. And so not only are you in charge of the child, but you are overseeing the parent and their needs, as well as the foster parents' needs and the child's needs. And so our goal as parent partners is to take on what that parent needs throughout the case. So we're not here to hinder, but we're here to be a support to the worker. What can we do for the parent? How can we help the parent get the services that they need, get the resources that they need, and allow you to focus on other things that you have to do in the day-to-day in regards to being a worker. And so when presenting that to them, they seem more open to it because they're like, well, that's less work I have to do in a day. And so our goal is to shift that mindset of we're not here to hinder anything. We're not here to make your job more difficult. We're here to support the family and reach that same goal that you have. And that's children re-entering safe and stable homes or going home to safe and stable homes. But we want that safe and stable home to be with their biological parents as long as those parents are safe. So we have had some challenges navigating that and changing that mindset and changing those biases. But when those biases shift and change, man, is it amazing the work that we've been able to do in just the short time that we've been here. And we've heard great feedback from those workers. Man, it changed the trajectory of this family's case, just simply putting a mentor on this case and having a mentor work with this family. And now we have parents reaching out saying, hey, how can I get a mentor? I want a mentor. And that's just been really, really awesome to see in such a short period of time. But yeah, so those are some of the challenges that we have faced. It's just those biases that that are just wrong, and we want to shift those. So
Great. Thanks, Lee. Lee, have you guys, just since this has come up in other questions, have you and Kim addressed it a little bit, have you had any challenges around sort of hiring individuals and with background checks and with using certain funding sources? Have you guys ran into that barrier and have any
yeah, that's a great question.
share?
So honestly, I haven't seen that become a barrier for us yet. We were actually just meeting before I hopped on here about our SOP for criminal background checks when hiring new mentors. We really, the baseline for us is if you don't have any sort of death or murder charges on your background, or been convicted in the death of a child or anyone else, and no sexual abuse conviction or sexual assault convictions, then then some of it will be like a, hey, I saw this, it's been a few years, but can you just kind of tell me a little bit about that? Because we understand that people can change. And so who they were when they got that convicted felony or when they got that conviction is not who they are now. And so there's certain things that we don't want to hinder. So drug charges, robbery charges, things like that, we really overlook, because if it's been within that year period, we ask that all our mentors be a year sober, a year with their children, and a year stable. So if it's way before that year, and not within that 1 year, then we don't really care. Because something I say regularly to our new hired mentors is, I don't know who you were before you came into your interview, and I really don't want to know. I want you to be able to thrive in the person that you are today. So, luckily, we've not had much pushback with our funding from DHS. They are aware that this is or OHS, I apologize. They are aware that that is how our program works. And we've been really fortunate for that same support from them. So.
Great. Thanks for that. Yeah, I didn't know, Kim or David, if you guys wanted to add anything to that, feel free to jump in. If not, you don't have to.
Yeah, I'd like to add something. It's a weird interview process when you're hiring somebody that actually has a criminal background. I mean, we're here. We're looking at all of the programs. We're looking for people with lived experience, and with that lived experience comes some wreckage from the past, some mistakes that have been made. And we also believe that everybody is not the sum of their worst mistakes, right? We can learn and we can do better. So I a little bit different than Leah. I want to hear about what their experience was with the legal system. I want to hear about what's going on. And when I've hired my team, I already knew about. I mean, they were part of our program as clients. So I knew what their history was already to an extent. But what better person to walk somebody through a court system that has already been through that court system? With our funders, the majority of our funding comes from behavioral health, and they understand that that 5 of our mentors are funded through them, and they understand where the mentors came from, so they don't care. The other part of the funding, oddly enough, comes from probation, which funds 2 of our mentor parents. That would be the program, the IPV program that we have, and IPV and criminal involvement. And we did have one mentor that they felt his charges were too extensive to be able to to have him under that contract. So I just switched mentors so that I could keep that mentor parent, because he's wonderful. And so that that's my take on that.
Yeah, that's great. Thank you. All right, well, we've only got about 10 minutes left. This feels like it's flying by. But I wanted to just ask each of you, what would you tell someone who is skeptical as to why a parent partner or a parent mentor is needed? And maybe they might say, well, the parent, they already have a social worker there or a caseworker, they have an attorney, like, sort of what would you tell that person as to sort of why a parent mentor is needed and what sort of they can bring that's really different from the most sort of child welfare setups. And maybe Kim, if it's okay, maybe I'll start with you on that.
I just want to mention that, being a parent myself who have had my children removed from me, three of my children removed at birth from the hospital, for example, to be able to have someone who has been through that, um, that can lean in and say, um, let me help you, or I'm here to help to assist you in that, meeting where I'm at first, in this very scary, intimidating process. I think that's what makes us so effective. I think that social worker, I can see the heart in everyone who touches the families that we support, families like my own. Um, but when you have that lived experience component, to be able to um, just meet them where they're at. For I think David really touched on that, just loving them um, in their current situation. I think that's what makes us so effective. I've seen families that were hard to connect with. I was that parent for the first year of the case, unable to be located, right? But to have a peer to be able to say, I get how hard this is. I know how it feels to question whether or not I'm what's best for my child, but to be able to believe in me, right? And so that's what we kind of do for parents, and that we've seen be very effective in supporting them.
Great, thank you. Thanks, Kim, for sharing that. Leah, I'll go to you next. What would you tell that person that had questions about that?
Yeah, that is one of my favorite questions when I go and present our program to Oklahoma Human Services. I get that almost every time. And my response is, but you're DHS, they're the attorney, they're these people that are on them and that they're afraid of making them mad or doing a wrong move or whatever. So, of course, they're not going to connect with you. Of course, they're not going to be eager to talk to you. Oftentimes, here in Oklahoma, when it shifts from child protective services to permanency, that shift isn't communicated. And so they don't recognize that the permanency worker wants their kids to go home to them. And sometimes it's not always the case. And so just like Kim said, she said it so perfectly, is but that parent gets it. That parent's a friend. That parent can be someone that helps them navigate that system in a completely different capacity than what the worker can do. The worker can have their own hardships, but if the worker's to look at them and say, oh, I get it, I know what you're going through, that parent's not going to respond that same way as if they were, if a mentor is to come onto the case and be like, I know what that feels like. Just like Kim said, um, the response is different. And so, what I always tell the workers when I present is don't vet your families. Don't say, oh, that's so and so. And anytime she interacts with us, it's just a nightmare. Well, you know what? Let me serve that mom. Let us work with her because I guarantee you that that mom will be our best mentee and she'll end up becoming a mentor in a year or two because we're not DHS. And so, Kim, thank you so much for sharing your perspective from a parent's point of view, because that's exactly right. That's exactly what I tell Oklahoma Human Services is it is so different when you've got the title and the badge than when you get down in the trenches with them and help them through it.
Great, thanks, Lee. David, I'll ask the same question to you.
Yeah, you guys, Kim and Lee, you guys nailed it. One of the things that I do want to add to that is, our mentor parents, they're amazing people. They got huge hearts. They love like nobody else does. They may not have a college degree, but they do have a degree in their own life experience, and they are freely willing to share that. And that comes across when you're speaking to a parent and that's scared. And we speak that language. We speak their language. Really quick, one of the things that really has always kind of resonated with me was I sat there one day and watched an attorney spend 2 hours working with this mom, and the mom was not willing to. I watched her, almost beg and plead with her to participate. And as I walked by, the attorney said, "Dave, can you just talk to this mom really quick?" So within 5 minutes, I had her working on, I had her engaged, and 12 months later, that mom reunified with the child that they were getting ready to close the case on. And what literally took me 5 minutes of just paying attention, listening, and changed this woman's future. And I've seen it a million times over. And it's just we mentors and parent advocates and all of whatever we're called, lived experience people, they understand. They understand what the parents are going through.
Great. Well said, all of you. We have just about 5 more minutes. I think we've answered quite a few of the Q&A questions. There are a few in there that I may afterwards, if the person has put their contact information, try and follow up with them. Just want to ask you all just maybe 1 minute each. Sort of what do you can tell you're passionate about the work, each of you. What is it that you enjoy sort of most about this work, working either as a parent mentor or with parent mentors? Kim, if it's okay, I'll start with you.
I think throughout all the different cases I had with child welfare for myself, I felt powerless in that process. And I felt like, I wish things were different. And so to be able to lend my voice in system level work and really see the changes happening, to see my first involvement was in 2003 and the change from that, how the system was being run, and how it is now, it just heals a part of myself. So the most rewarding part again is to see the changes, the outcomes, the better outcomes for families that we serve.
Great, thanks, Kim. Lee, anything to add to
Yeah.
that?
I think my absolute favorite part of my job is being able to watch these mentors grow. They come in so scared, so nervous, so hesitant, and just watching them blossom and be like having this sense of like self-confidence that they didn't have before, coming in so meek and quiet, and then all of a sudden this same individual is sharing their story to hundreds of DHS workers, to other mentors. And we the one I think of in particular, I mean, I think of all of them, but we just hired another program coordinator based off the fidelity of the model. She got hired on, and I remember when she walked out of her mentor interview, me and my boss looked at each other and we're like, I don't know about this one, but we'll see. And man, did she blow us out of the water. She was an incredible mentor. She became our first lead mentor, and now she's my coworker. And just, man, I'm tearing up just thinking about it. Like now she's my coworker, and I just think that's so cool to be able to see that growth and to know that there are going to be so many more like that coming up here in the future. And that is my favorite part of my job, is being able to empower these individuals to grow into something that they never thought that they could do or be. We've got so many of them that are now going back to school and getting their GED or getting their associates, and man, that is my absolute favorite part of my job.
Great, thank you. Thank you, Lee. Dave, 1 minute for you, and then I'll wrap up here.
Lee, I love it. That is one of my favorite things too, is to watch these mentors grow. I don't want them to leave, but when they do leave, to go do something amazing. And like right now, a team of my mentors are working, are doing a training with 250 judges around the state of California to try to help them be better judges by understanding where we come from and what our experience is. So, and we're doing this on a weekly basis. We're going out and talking to people, and I love watching my team stand up on that big stage and making a difference in our state and our county.
Great. Thanks, David. Just want to thank all of our panelists. I think really appreciate all of you. I'm not sure Kim had to get off, but just fantastic. A lot of great feedback there. Here's my contact information. I think you all get the slides actually after the session, but feel free to reach out to me, and I could reach out to the panelists as well. It's just a big sort of movement. This, parent mentors, and it's such a great strategy that I think any state would want to do. So just want to keep growing it. So thanks everyone for joining. Appreciate it. Feel free to reach out and have a great day. Thanks everyone. Thanks to our panelists too. Appreciate it. Y'all being on.
Thank you, everybody.
Thank you so much.
Bye.